And we have our next presenter, who is Dr. Naveen Gupta from the United Kingdom. Dr. Naveen Gupta has been practicing and teaching Ayurveda medicine for 4 decades, out of which the first 2 decades he practiced in Delhi, and the last 2 decades in Belgium, Netherlands, Germany, Switzerland, and the United Kingdom. Dr. Gupta is one of the very highly specialized Vaida in pulse diagnosis, herbology, and marma, the vital points in human physiology, and pancha karma. Dr. Gupta has a deep interest in a whole range of Vedic healing arts, sciences, and technologies for achieving the highest quality of health and consciousness. For the question asked by his students and patients related to his talk today on Vedic psychotherapy, how Ayurveda fixes the challenges in functioning and relationships in a day-to-day basis by a person in these times. Dr. Gupta brings an ancient wisdom and pure knowledge of Rishi and Maharishi with a new cover in these modern times in his signature style. Over to Dr. Gupta, who represents the United Kingdom and the Congress. Thank you.
Thank you, madam. Thank you, Dr. Tomasz, to invite me for this beautiful Congress. I'm not used to sit and talk because I've been teaching all the time while I'm walking freely on the podium, but here the space is less, so I'll try my best to manage. Before I move to the next slides, I would like to talk about what is Vedic psychotherapy. And here I want to tell that the Vedic world has come from Vedas. And my guru, first of all, I say Jai Gurudev to everybody. My guru, Shri Maharshi Mahesh Yogi Ji, he introduced me for the first time in 1986, while I already graduated in 1983. So this is my 45th year in Ayurveda. And Guru Maharshi told at one of the conferences which I was attending for the Vaidyas in Delhi, he spoke in Hindi, of course, and he told that in Ayurveda today, there is only Ayur and Veda is missing. And that is true. That was true also. And I was also one of the practitioners in Delhi who was practicing Ayur, not the Veda. I admit it today. But when I heard Maharshi saying that, then I make a paradigm shift in my practice, and I practiced Veda. So Veda, what is Veda? Veda is the source of integral knowledge and pure and just pure science, tradition and culture of a remarkable and distinguished civilization. These are the oral compilations which my Guruji used to say. I'm just repeating that. These are oral compilation of distilled wisdom that is inherent in universal soul, the cosmic consciousness. When you know an hourglass and the sand comes from the hourglass. So Maharshi used to say one time that the whole cosmic consciousness, the whole galaxies and galaxy of galaxies, imagine that is the hourglass, and there is sand. Each and every particle is one galaxy in itself. And then in the hourglass, the galaxy comes to the individual through our Brahmarandra, the syrinx of our Brahmana, our self. Then he used to say that, so this is how we receive the knowledge, from the cosmic consciousness to be the individual consciousness. This is what Maharshi used to say, and I'm just Shishya, pupil of Maharshi ji, so I will just take his talks forward. Then the next thing is that, What is psychotherapy? Before I come to Vedic psychotherapy, I'll just try to say what is psychotherapy. One of my great admirer of one of the person who is sitting here, Rajaji from Italy, and Professor Bruno, and because he's a psychiatrist, and he will be speaking after me, and I know what he's going to speak about 3 things, which I will not speak so that we don't overlap each other. So psychotherapy or psychological therapy is the use of talking methods, particularly when based on regular personal interaction. It's not that a patient is coming to a psychiatrist and you had one-time discussion and it's over. It should be a regular personal interaction, one-to-one level. And to help a person change behavior, increase happiness, and overcome the problems. Psychotherapy aims to improve an individual's mental health and emotional well-being to resolve or mitigate troublesome behaviors, beliefs, compulsions, thoughts, or emotions, and to improve relationships and social skills. This is the most important part today about the psychiatry, the relationships and social skills. So this is why I've explored 4 stages of Vedic psychotherapy. And I will never say that I have explored, but I didn't find any good meaning because I'm speaking to the audience in English. So if I would have been speaking in my language, my mother tongue, which is Hindi, and pure Hindi, then I would have said differently. But here I'm saying that I've explored the 4 stages of Vedic psychotherapy. Preparing for the therapy, that's 1. 2, practicing therapy, that's 2. Protecting therapy, that's 3. And perfecting therapy, that's 4. So practicing, protecting, preparing, practicing, protecting, and perfecting. That's the psychotherapy. And that's Vedic psychotherapy. With simple exercises and takeaways. Psychiatry is a very, very simple subject. It is so simple. Any patient for any disease, from small depression or sleep disorders to small headaches, I'm talking about the small, to senile dementia, to Alzheimer's, to whatever length you can talk about, bipolar disorder. Psychiatry is so simple to handle when it comes to Vedic psychotherapy. But unfortunately, the psychiatrists all over the world, they have made our subject so complicated, then the whole issue is getting so much over-exaggerated in the whole world. While the psychiatry is so simple. So we have to just, these 4 principles, and we are reaching to the right goals. I will tell that one thing here. I'm from Ayurveda. I'm a physician. And I do see patients all the time. And we first and foremost thing for a physician of an Ayurveda is to make a pulse diagnosis. And pulse diagnosis is not just about what is practiced in the West, just to say about what is your constitution, what is your prakriti, what is your biotype, what is your mind type. It's much, much beyond than that. And there are many, many levels. As you dive in a sea, or you dive in a river, or you dive in a lake, then you know how many pressures are different levels. So the same thing in pulse diagnosis, which is my specialty. And Maharshi Ayurveda Nadi Pariksha. This is called Maharshi Ayurveda Pulse Examination. And secondly, Dut Nadi Pariksha. That means if somebody is carrying the message from one of the person related to him, sitting distantly, maybe few 100,000 miles away, still, if you take because this person is carrying the bhava, the impressions of that person in him or her, if I check as a pulse diagnosis specialist, the pulse of that person, from this person, I can go to that person who is sitting thousands of miles. And that is called Dut Nadi Pariksha, Messenger Nadi Pariksha. My teacher for that was guided by, I went to Bharaspati Dev Triguna ji, we call it Bade Vaidya ji, whose son used to be my college mate, Devinder. And I studied in Tibia College in Delhi University. And his father, I went to his father to know more deeper about the pulse diagnosis. He was so busy. 300 patients per day he was seeing. So I could see some patients distantly with him, but I was not allowed to go very deeper into talks with him because he was so extremely busy. And then he told me, Naveen, if you give me answer of this, but he asked me some verses from our Ayurveda books. If you give me this answer, I'll say to you something today. And I gave that answer in Sanskrit. And he said to me, I'm sending you to Pandit Satyadev Vasishtha, which is around 200 kilometers away from Delhi, north. And I went to him to learn all this pulse diagnosis. So I'm happy to share that I'm a Maharshi Ayurveda pulse diagnosis specialist. Now, with Dr. Pandey and Dr. Bruno, we were discussing in the coffee break. So I call it tea break. But we are in Prague, so we can call it coffee break. I call it tea break. So, or rather, if you're in India, I call it chai break. But let us see that. Then we were discussing about it, that how you see the whole human body, and then how you enter into the head cavity. So I mentioned that, I'm saying that now. If we divide our body, we can divide simply into the 4 departments. Simply 4 departments. So the head department, the thorax department, the abdominal department, and the pelvic department, pelvis. If you divide the 4 departments, then every department has 7 lives. In every department, there is 7 lives. And today I'm going to talk only about one department, and that too, Patitu, only very little. Because if I start talking about it, I cannot stop for days and days. And forget about hours and hours. I'm teaching for days and days. Months and months, years and years I'm talking for last 30 years in Europe. When we talk about the head department, I said 7 lives. There will be 3 pairs and only one. So 3 pairs, that makes 6, and 1 that makes 7. So I will not ask anybody because it is less time, otherwise the hooter will come and then I will not be able to speak too much about it. So I will not ask this question. Normally I should have asked this to all of you. And I'm 100% sure when we say 7 lives, everybody one by one would have come up and I don't have to teach anything. But I will say now. We have 2 eyes, we have 2 ears, we have 2 nostrils. That makes 6 lives. And what 1 is remaining? This I can ask. That is only 1. There's no 2. What's that? Can I ask that? Mouth. So simple. So if I would have asked you before also, you would have replied all the eyes, ears, everything very simple. Now, the crux of the story is that these are the 7 lives. Now I have to a little bit take paper so that I don't talk too much about it. As I said, in every department or cavity, there reside 7 lives. We call it 7 pranas. So Panch prana in the 7 pranas. 5 prana in 1 prana, and then we are talking about the 7 pranas. So you can calculate how much prana we are talking about. And that is about performance of actions, which usually termed as Indriya. We call it Indriya because it comes from the Lord Indra. The whole knowledge of Ayurveda has come from the Lord Indra. Then passed on to Jai Gurudev, passed on to Maharshi Mahesh Yogi, and now I'm the disciple of him. So I'm so grateful to have that teachings. So what I want to say here is that this Indriya, you know about cognitive organs, you know about organ of actions. So we call it Jnana Indriya, the cognitive organs, and we call it Karma Indriya, the functioning organs. So we have 10 Indriyas in our human physiology. And let me come to the point. The center of the 7 lives, I'm sorry, I will be speaking very fast now. The center of the 7 lives, this is most important. There is one central life which gives strength to all the 7 lives. There is one central life which will give strength to all 7 lives. So this is the crux to all KNO specialists, ENT specialists in the whole world. psychiatrists in the whole world, the ophthalmologist in the whole world, the buccal surgeon or buccal physician in the whole world, and the ENT I already spoke. Anyway, so out of the 7 lives, the center of the 7 lives is the strength of the 7 lives. And this is Brahmarandra, from where all the super consciousness is entering into you. And what is Brahmarandra? This is the cervice of Brahmana, the crown. The crown of the head is called Brahmana, and I'm very after second Bhutar, I should stop. The Brahmarandra is the one which is controlling the 7 lives. So any ophthalmologist, any ENT specialist, any psychiatrist, listen loud and clear. In letter and spirit I'm talking, that the whole essence is in the one central life, that is our Brahmarandra. Crown, you can call it crown chakra. Thank you very much. Jai Gurudev.
Thank you. And that was Dr. Gupta, and we thank him very much for his wonderful presentation. He was talking about the Vedic psychotherapy, mental health, and emotional well-being, the importance of a true personal connection and a Vedic approach. Connection which dramatically differs from the conventional approach, and it would be really interesting and beneficial to see these 2 approaches connecting.